We're back, and this is a red letter day for us here at Securing America because it's an opportunity to discuss with one of our country's most eminent and I think most courageous medical practitioners, Dr. Peter McCullough, a renowned internist and cardiologist based in Dallas, Texas, the co-author with John Leake, the book, The Courage to Face COVID-19. And I couldn't be more pleased to have him back. Dr. McCullough, thank you so much for finding time. I know how frantically busy you are. This is really an important contribution to our efforts to educate the public about the sorts of work that you do. So we appreciate you being with us. Level set for us, if you could quickly, where we are now with respect to COVID-19, what we know about its provenance, the response to it to date, and what we should be doing about it going forward.
Frank, there's been two disturbing reports. One recently, I broke on my Substack, report out of Japan. Scientists are concluding the Omicron variant, unfortunately, was manufactured. That we're now looking back on this and thinking maybe the pandemic would have been over with after Delta. But now two labs have confirmed that Omicron looks like it was manufactured. This may be what Jordan Tristan Walker, the Pfizer executive that was stung in the Project Veritas operation on Pfizer, it may be what he said. He said that Pfizer was doing directed evolution, was going to release a virus and then chase it with the vaccine. Fortunately, Omicron's a lot milder, but it did actually prompt more vaccine development.
It did indeed, which presumably was the point of the exercise. Which brings me to the question, sir, the nature of the vaccines. There are those who believe that they themselves are a form of biological warfare agent. They've certainly proven to be deadly to a great many people and tremendously harmful. One of our colleagues has estimated that within the military, for example, 1 out of 9 have been either murdered outright or permanently very severely harmed or temporarily severely harmed. Does that sound right to you? And where do you come down on that question?
Yeah, the estimates of deaths per dose now is probably about 1 in 1,000 doses. There's death. Some occur right on the day they take the shot or a few days after. We now have an autopsy paper. It's leading all papers on downloads and reads on the European Commission Zenodo server. And we've surveyed all the autopsies published one by one now in a big paper, independently adjudicated conclusion. 73.9% of the deaths that occur after the shot are directly due to the shot. So we have now conclusive evidence, Frank, and you're right. At this point in time, they've surpassed all limits of acceptable safety. I called on the floor of the U.S. Senate last year for all the COVID-19 vaccines to be withdrawn.
And rightly so. And the fact that they're not, and the fact that we also have growing evidence of actual fraud on the part of Pfizer and I think now Moderna, just raises further the question of what is being done to not only get these things off the market, but also to compensate people who have been so grievously harmed.
There is now clear, unequivocal evidence of fraud, taking shortcuts on clinical trials, misrepresenting data, all to rush these vaccines to market. Recently, Frank, this has come out in the Australian Parliament where Pfizer executives were grilled. And we were stunned to find out that there were special restricted lots of vaccines for the Pfizer employees. Now, people are furious to think maybe they got vaccines that were modified in some way to be less injurious.
Wow. As well as evidence of, among other things, from our friend Dr. Robert Malone's own experience, that there were quality control problems that made some batches even more lethal than others. I mean, this whole thing just sinks to high heavens and makes all the more important the work that you've been doing, Dr. McCullough and other frontline doctors who've been actually saying, wait a minute, there are better ways to deal with this particular problem, which brings me back to the earlier question. What should we be doing now in terms of the treatment for COVID, and also with respect to the idea that we have to be doing more of what we did the last time, which is, chasing the disease with untested or certainly inadequately tested vaccines.
Well, the step one is stop taking any more vaccines. They're far outdated. They have no hope of helping patients, only causing harm.
And that includes these so-called boosters.
Right, including all forms of boosters. We now have very good clinical experience and data, 17 studies now, high quality, that virucidal nasal sprays and washes work, Frank. Virtually any one, povidone iodine, xylitol, colloidal silver, hydrogen peroxide. Get a high quality virucidal nasal spray and gargle. Scope and Listerine work well. First hour of any symptoms, start immediately. That's going to work for COVID, the flu, Marburg virus, you name it, the next pandemic. Be ready. Everybody should be fit, in shape, well stocked up on their vitamin status. Recently, by the way, Dr. Mary Talley Bowden, leading the plaintiffs who's suing the FDA admitted in court this week that ivermectin can be used to treat COVID, implying that it isn't effective, as we've all concluded.
No kidding. After all these months and now years, I guess, of having made exactly the opposite claim insistently and punishing docs like yourself who have prescribed it, hydroxychloroquine and the like. This has so grievously eroded confidence, I think it's fair to say, in our public health authorities, Dr. McCullough, that it raises afresh the question of what's next. We keep hearing the Bill Gateses and the World Health Organization and others around the world saying there's some new disease X or some new pandemic coming our way, and that what we need is more, it seems, of the same, more lockdowns, more control, more digital monitoring and surveillance and the like. And I want to ask you, after we take a very short break here, Doctor, to talk a little bit about lessons learned here and things that we absolutely positively should not be doing now,
right,
that ensure that we will see, especially if what comes next, manufactured or otherwise, is worse than what we were afflicted with in the past. How do we avoid making the same mistake, only perhaps, again, worse? That and more with Dr. Peter McCullough right after this.